Good morning. My name is Shannon McConville, and I'm a senior fellow at the Public Policy Institute of California. Welcome to our virtual program today, featuring the findings from PPIC's report on training for healthcare jobs in California. The report, technical appendix, policy brief, and slides from today's briefing can be found on our website at ppic.org. This research and event are supported with funding from Blue Shield of California Foundation, Gates Foundation, the James Irvine Foundation, and Tipping Point Community. We'd like to thank them for their support. For today's program, I will present some of the key findings from the report and then turn to questions from the audience. If you have a question, please send it along with your name and organization to the email address on the screen, ppiceventquestions@gmail.com. As a reminder, PPIC is a public charity and does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. And now on to the presentation. So in this report, we're studying health training pathways, and the focus is really to understand how training programs in healthcare that prepare people for healthcare jobs can promote economic and mobility for more Californians. We focus on the healthcare sector because it's one of the largest employment sectors in the state. In 2024, there were over 2.4 million healthcare jobs, representing more than 13% of total jobs in the state. Also in the healthcare sector, there's a wide range of different types of jobs that requiring varying levels of education and training. On the one end, we have physicians and therapists and dentists that require advanced degrees and many years of training in order to be in that occupation. At the other are direct care workers, who are a key and critical support for older adults and people with disabilities and provide care for daily needs. And then in the middle, there are some, oftentimes we call them middle skill jobs that require some post-secondary training, but not a 4-year degree. And that's really where we're focused on, and really where we're focused on this report. It's also the case that several of these jobs that do require some training but not a 4-year degree offer relatively high wages compared to other jobs in the economy. And finally, much of our focus is on California's community college system, as it is the primary publicly funded provider for health programs. So which health occupations and jobs are we talking about? Here's a list of the different jobs that we are focused on in our report. As you can see, we selected these jobs again because they do require some amount of training, and the community colleges do offer training for all of these jobs. We have nursing pathways. These include registered nurses, licensed vocational nurses, I may refer to them as LVNs, and certified nursing assistants, CNAs, medical assistants, dental pathways, hygienists and assistants. We also do include some behavioral health positions, psychiatric technicians who tend to work in state hospitals, along with alcohol and drug counselors. And finally, allied and technical roles. These include radiological tech, respiratory therapy, paramedics, emergency medical techs, and pharmacy technicians. In the report, we also go over where a lot of these jobs are located, what types of industries. And so, for example, most registered nurses, psychiatric techs, radiological techs, and respiratory therapists are primarily employed in hospital-based settings. On the other hand, jobs in the dental field, hygienists and assistants, along with medical assistants, are primarily in outpatient and clinic settings. And so first, this is to show kind of what the wage levels look like for these jobs. What this figure is showing is the median wage, the median occupational wage for each of these healthcare jobs compared to the state's minimum median wage, which was about $27 per hour in 2024. And we've really we've grouped these into high, medium, and low groups based on the wage levels and earning levels. And so what you see here is in that high section, we have registered nursing, dental hygienist, and radiological tech. Those occupations command wages that are up to 2.5 times higher than median state wages. These jobs tend to have hourly wages more than $60–70. Median wage or return jobs, those are LVNs, psych techs, paramedics. They also confer or tend to pay higher wages than we see kind of economy-wide. And then on the lower end, jobs like medical assisting, CNAs, and EMTs tend to pay right below that state minimum wage. The median wage for these occupations is around $23, $24, $25. And not surprisingly, perhaps the wage levels and the earnings returns that we see to completing health training programs really do align with the training intensity and educational requirements for these jobs. In our paper or in our report, we present information on wage returns to each of these occupations. And these wage returns are based on statistical models that try to estimate really the value of what it means to complete a training program. And to do this, what we do is we look at a person's wages prior to entering and completing a training program, and then up to 6 years after that. And what we find is, again, with those high wage occupations, all of them require at least an associate degree and often take several years to complete, both due to prerequisite requirements to enter the programs and also the length of time it takes to complete them. But with that, we also see that for each of these occupations, people who complete them tend to see a doubling of their earnings within 6 years of completing the training program. That compares to more of the medium wage occupations. These often require a long-term certificate, which takes 1 to 2 years of full-time enrollment in order to complete. And there we also do see substantial wage gains of about 40% above and beyond what that person would be expected to make had they not completed the training program. And then finally, for that group of lower return programs, these tend to be short-term programs, sometimes just a few months in order to acquire the skills and complete the training for the job. And we don't find much of an economic boost beyond what a person would likely have earned in the absence of completing that training program. I'll just also mention in the report, we do have these returns for each of the different occupations that we're focused on separately. And so how does training improve economic security? To answer this question, I mean, obviously, having greater earnings potential and access to jobs that pay higher wages will promote economic security. We also, in the course of this research, spoke with community college career counselors and nonprofit organizations, so training providers that engage with students who are pursuing training, and to ask them about how people choose health programs and what it can mean in terms of their opportunities to improving their economic conditions. We heard from them that for a lot of students, the value or the desire to pursue health training was really that certification, once they were done, they would have a clear idea of what type of job and what type of employer that they would have access to. We also heard, and which is many of these training programs also include an on-the-job component of clinical placement. So that is, the student needs to do on-the-job training at a particular employer, a hospital, a doctor's office, and through those on-the-job training requirements, they get connections to potential employers. And finally, another piece. So we saw that people who complete shorter-term credentials or shorter-term programs that prepare you for jobs that, say, have lower returns, there are opportunities if people return and complete additional education and credentials. There are opportunities to move along a career ladder and really improve their earnings mobility. I will say that in past work, when we've looked at this explicitly in the healthcare space, while we do find about half of people who earn certificates do return to the community colleges to complete additional training, only about 20% successfully complete another credential in healthcare, and again, to move along and to access a higher paying job. So next we turn to where people go to complete training programs in California. And so this figure is showing associate degree completions in both public and private for-profit institutions in California. The public institutions are all community colleges. And so again, this is looking at the associate degrees completed in California institutions. What we see is in the community college system, registered nursing programs, these are associate degrees in nursing, or ADNs, really are the bulk of associate degrees that are conferred by the community colleges in the health space. We also do see some much smaller numbers for rad techs and dental hygienists. On the other hand, in the private for-profit space, we do see some associate degrees in nursing, along with some other programs. We do provide some information about the costs of these, the differences in costs between these two systems. And so that obviously can have implications for the ability of people who complete them to see economic returns to their training. The public community college system costs much less than private for-profit colleges, although we also heard from some workforce training providers that the speed in which that they can complete programs within the private for-profit system may be of value to for some folks. And here we're focused just on community colleges, and these are per capita enrollments in high return, and that set of high return community college programs. And so this is really going to be dominated by registered nursing programs that lead to an associate's degree in nursing. And what we see is there are large differences across the state in enrollments in these high return programs. And so we see places in the Central Valley, Kern County, Central San Joaquin have relatively high per capita enrollments in high return programs, as does the North State and Central Coast, relative to more southern regions and larger populations. I will note this is only associate degrees in nursing that are available at the community colleges. It's also the case that more than half of registered nurses enter the workforce with a bachelor's degree in nursing, or a BSN. And so it may be that in some of these regions, there's more access to those types of programs, BSN programs. I'll also note that in places where community colleges do have higher enrollments in the Central Valley, in the northern regions of the state, that higher shares of people who enter registered nursing do so with an associate's degree in nursing. So now turning to who's enrolled in these community college programs. And so here again, we're focused on this set of high return programs, and we're looking at student enrollments for the school year 23-24. And we're comparing enrollments in registered nursing programs, radiological tech programs, respiratory therapy, and dental hygienist programs. Again, this set of high return programs to the overall community college student body. And what we see is a much, much higher share. More than 70% of students in these high return programs are at least 25 years or older. And this is in stark contrast to the overall community college enrollments, where about 65, about almost 2/3 of students are in that traditional college age of 18 to 24 years old. And so this points to both, as I mentioned, the time it may take to access these programs and the prerequisites and other things that are required, but it also signals that people that are in these training programs are likely managing other responsibilities, whether those are family obligations, whether those may be needing to work other jobs. And so kind of balancing those things can be challenging. Another component of this research was we did talk to some training providers, and in particular, community college career counselors and nonprofit workforce agencies. And they really elevated some of the things that we may see here, that a lot of the people that they work with do have childcare responsibilities and are balancing multiple things. And that can be a challenge when they're trying to complete training programs to improve their economic circumstances. And so they really elevated the need for financial supports, whether that's financial aid, whether that may be other wraparound supports, to really help students successfully complete these programs and realize those economic gains that can come from them. It's also, that piece was about the associate degrees in nursing. Those were those high return programs. What we see here is, again, we're comparing training institutions, so the public community college sector and private for-profit sector, of health credentials, and these are the number of long-term certificates that are conferred in health programs. And what you see is that more than half, the majority of all sub-baccalaureate health credentials conferred in California are completed within the private for-profit system. Again, I mentioned, this private for-profit institutions may be able to help students move through those more quickly, complete programs more quickly in shorter time periods, but there is a cost associated with that. Many students who attend for-profit private colleges do receive financial aid, and so that helps them, finish the programs and gives them that financial stability in order to do that and complete training. However, it also means that they are needing to repay those loans as they enter the workforce, and that could put a hampering on their ability to have economic mobility and really see those earnings gains because of the need to pay back some of those loans. When we look at the profile of students who complete health credentials in these different systems, we see that far more Black and Latino students are accessing are completing health credentials within the for-profit system. For Black Californians, about 70% of the health credentials that Black Californians complete are done within the for-profit system and are certificates that do tend to have lower wage returns. Latino students, about 60% are completing credentials within the for-profit system. We see higher shares among white and Asian students accessing the community college system for their health training and the awards that they complete. And again, I mentioned, we did do some focus groups with training providers to understand kind of what were some of the both opportunities and challenges. And so here we're focused on some of the barriers that they elevated for us in terms of the ability of people to access programs that can really support their economic outcomes. And what we heard over and over again, one of the most common themes was that there was limited capacity and long waiting lists. This was especially true, or is predominantly true, for those registered nursing programs. We heard from community college career counselors and directors that they had students who would say that they were place-based, that they really wanted to complete a nursing degree, but that it needed to be at this community colleges. And because they may have to wait a few years in order to gain access to the program, that a lot of times they may not be able to do that. And, one of the things that they said was life happens, and then they're not able to kind of get into that or to do that program. They also elevated that when students weren't able to access some of those lower cost, again, primarily nursing programs, they would turn to private for-profit providers, and those do have much higher costs. We did look at some of the costs again for registered nursing programs, and say to do an associate degree in nursing at a private for-profit, it was about 7 times as much for fees and tuition than it was in the community college system. As I mentioned before, training providers also elevated childcare and family obligations and financial considerations really as both key supports that people need in order to be successful in these programs, and the kind of barriers that can keep them from pursuing training, but also from dropping out of training that they have begun. And so to summarize some of the key takeaways, we really do see several of these health training programs that require some post-secondary training can really improve people's economic trajectories. As we've shown, the type of program, the length of training, and the pathway that they choose really is a critical decision in determining how much economic gains a person will be able to achieve through health training programs. Again, the more intensive programs like registered nursing, like dental hygienist programs, yield very high returns, but they also are the more difficult to access and complete. supporting people through various means, whether that's financial supports, financial aid, childcare, and others could help more workers advance and perhaps return to complete additional training if they do start out in a shorter term program. And then we also include in the report, it's really important that both training providers, community colleges, as well as potential students and people pursuing training have accurate information about what the job opportunities are, what the labor market is going to look like in the future, what employers are demanding for these things in order for people, for these programs to really meet the needs, the state's workforce needs. And with that, I will conclude the report. At this time, I would like to go ahead and answer any questions from the audience. Okay, it looks like we have one question. How do returns to for-profit health programs compare to community college programs? That's a very good question. And so I should note, and I don't think that I did, all of the wage returns that we include in our report are only based on community college programs. In part, that's because we have better data and information provided by the community college sector. In our past work, we were fortunate enough to collaborate with the Community College Chancellor's Office to have access to their longitudinal student records. Those were then linked to EDD quarterly earnings records. And so with that information, we were able to really provide good estimates of what returns looked like to these specific programs. We have less information in about for-profit enrollments and eventual outcomes. There are a few studies from different states that do elevate that some for-profit programs, particularly in health, do confer quite a bit of wage gains as well. Although overall, the research suggests that for-profit institutions, because of their higher costs, often don't pay off for students. But again, health programs in particular are somewhat unique. I didn't mention this, but meant to. Many of these occupations require state licensing. And so in that way, the training program prepares you to take the licensing exam. It's that licensing exam that the employers are going to want and are paying for. And so whether you complete the training to prepare for the licensing exam in a for-profit or a community college, most employers are not going to see that. They're going to just need to know that you have completed that licensing. Another question, how often do people complete multiple health credentials to advance to higher paid positions? I did mention this. So in our past work, which is now somewhat dated, it's about 10 years old, we found that only about 20% of community college students who initially earned a short or a certificate in a health program successfully completed another health credential. So again, this idea of stacking credentials to a higher level position. I will say this, one of the big gaps in our information or our knowledge base in this space is we don't know if people say complete something at the community colleges and then move on to the private sector to complete additional training. And I do think that that is a very important gap, especially in the healthcare sector. So for example, if a student completed a nursing assistant program at the community colleges, and then perhaps we're waiting to hopefully get into the registered nursing program at the community colleges, if they're not able to, oftentimes they do move on to the private, whether it's for-profit or nonprofit sector. And we don't observe that in any of the data that we've had access to. I will say our hope is that the new Cradle to Career data system will provide that information that I think is really critically needed to understand how people may be using or completing training across multiple institutions. We have another question from Kathy Anderson from the Sacramento Bee. If you could point to one change to expand access to the high return programs, what would it be? Well, given that we do see such high returns to registered nursing, and the training providers that we spoke with really highlighted that for us over and over again, that they had many students, that they had many qualified students who, again, had to wait several years. I know that there was a bill this year on that was vetoed by the governor that was looking to expand bachelor's degrees, so BSNs within the community college system. But as I understand it, that was not going to increase capacity in those systems. Now, the Bureau of Registered Nursing is the entity that kind of manages all of our training for nursing, and so obviously they would need to be engaged with any of this. But trying to find ways to expand capacity within the community colleges for associate degrees in nursing. And, again, BSNs are an important component of the registered nursing workforce. However, associate degrees in nursing do qualify you to take that licensing exam to start working as an RN. And then once you're working as an RN, you can take programs to advance to a BSN, and finding smoother ways for people to move, say, from an ADN to get to that BSN, and in a public setting where costs can be lower, I think would be would be beneficial, or could help expand access to those higher return programs. And this is Diane Rogers, Rancho Cordova Area Chamber. Are you aware of any efforts to expand community college options? I am very confident that there are a whole host of efforts underway to expand those community college programs. Oftentimes the constraints that we hear quite a bit about are that it's difficult, that some of the difficulties that people elevate are that they have difficulty finding faculty, in large part because for nurses, you can earn more money if you are in a hospital setting or working as a registered nurse or an advanced practice nurse, as opposed to teaching. So finding ways to provide higher wages for nurses to come to the community colleges to teach is something. Also, people also often elevate clinical placements. Those are a key part of the training program or for registered nurses. I do know that during, and I'm not sure to what extent this is possible, but, are there opportunities for clinical placements to at least partially perhaps be done in different settings, to expand kind of opportunities for clinical placements and completion? Let's see, we have one other question. Jason Cordova from the James Irvine Foundation. Was paid training or registered apprenticeship seen as an option to ease the barriers to access and completing programs? So this is an excellent question. As I understand it, so as I mentioned, several of these programs, such as registered nursing, licensed vocational nursing, rad tech, respiratory therapy, lots of these do have clinical placement requirements. However, as opposed to paid apprenticeships, when you're in clinical placement as part of a training program, you cannot get paid. And, I think a lot of that has to do with things related to training requirements, or, that the people on the job have licenses. People who are in training do not have licenses, and therefore they're not able to be, working. And so I think that's one of the barriers to paying them. But I do think that that is a place where people have been working to try to understand how to expand options for providing paid on-the-job training for people in health programs. Okay, one final question. What health occupations are expected to grow the fastest? This is a great question, and I think it's a question that actually honestly has more uncertainty. We have things happening at the federal level that may roll back some of the coverage expansions California has seen. That could impact healthcare utilization patterns or workforce demand for healthcare workers. I will say when we started this analysis, we use EDD, occupation projection data. When we looked at the most recent year that was available when we started this project, we saw really large growth across all occupations that we studied. Before we finished the project, the newer year of projections came out, and several of those had been downgraded, and some of those that had less, had less job growth than just the year from the projections prior. And some of those were nursing assistants, LVNs, and a few other occupations. They were still growing and growing about on par of all jobs in the state, but it was much lower than even the year before. So I do think, projections, job growth is a difficult thing to estimate, and especially as we have some uncertainty especially in the federal environment, I think that makes it a challenge. And with that, we've reached the end of our program. I want to thank all of you for joining me today. I'd also like to thank our funders, Blue Shield of California Foundation, Gates Foundation, the James Irvine Foundation, and Tipping Point Community. We would appreciate you taking a moment to give us your feedback on this event. If you pre-registered for this event, you'll receive an email later today with a link to a short survey, but you can also scan the QR code on your screen right now. Finally, a recording of today's event will be available on the PPIC website and our YouTube channel soon, so you can watch it again or share it with your network. Thank you and have a good afternoon.